Hypertension is a recognized potential class toxicity of covalent BTK inhibitors, and we know that patients with CLL tend to be fairly commonly have hypertension or comorbid illnesses. And so what we were trying to really look at is in a very large cohort of patients, could we identify whether patients had a change in hypertension being on acalabrutinib compared to baseline risk. And the first thing we found was that patients with CLL very commonly have hypertension, so just under 60% of the cohort at baseline was identified to have hypertension. And I think in a very encouraging way, what we saw is that we didn't really seem to see a worsening of hypertension in the patients on acalabrutinib or new development of hypertension in patients who did not. And when we compare that to either control arms of studies in which acalabrutinib was the experimental arm and there was another standard arm, or looking at specifically ibrutinib as a comparator arm in one of those trials, we see that really we didn't notice any increase in hypertension across a very large number of patients on trials.